All right, welcome in everyone. Welcome to the African American Child and Family Research Center's Research Capacity Building webinars. My name is Latrice Rollins. I'm honored to serve as the Director and Principal Investigator of the Center. I want to take a moment, just as we are getting started, to encourage you all to register for our conference that is coming up here in Atlanta. This will be our fifth conference. We are very excited to welcome everyone to Morehouse School of Medicine to hear about a number of community engaged research approaches and projects that are happening in the spaces of economic stability and early care and education. So absolutely hope that you all will join us. I'll make sure to put the link in the chat later on. But if you haven't already registered, you can scan the QR code here or absolutely go to our website and get more information about the conference. All right, so we're going to jump right in. This is the webinar, Navigating Change, Strategies for Responding to Shifts in Public Assistance Programs. I know you all have seen a theme in our webinars this year, lots of navigation. We are trying to figure out how to be responsive to the times and make sure that you all have up-to-date information on how you can manage and navigate the times that we're in. And so I want to stop sharing here and start to introduce our speakers so that they can start to pull up their slides and things like that while I share their bios very quickly. So first we'll have presenting our partners at the Center for Law and Social Policy, Parker Gilkesson Davis. She is a senior policy analyst with the Center for Law and Social Policy, the Public Benefits Justice team. And she specializes in work support programs for people with low incomes and focuses on the Supplemental Nutrition Assistance Program, or otherwise known as SNAP. She is a subject matter expert in social policy, benefit eligibility, human services delivery, community partnership, and state and local policy regarding SNAP, temporary assistance for needy families, or TANF, and Medicaid. She has been quoted in many outlets, and prior to joining CLASP, she began her career as a human service specialist in Mecklenburg County, North Carolina, where she worked directly with people to determine their eligibility for Medicaid, TANF, and SNAP. Also presenting along with her is Ms. Teon Hayes. She is a senior policy analyst as well with the Public Benefits Justice team at CLASP. Her policy portfolio includes food access, spanning a number of programs, including SNAP, WIC, and some recovery supports for mothers who are navigating substance use, among others. But in addition to her policy work, she co-leads the organization's community partnership group, which is a cohort of individuals with lived experience navigating public benefits systems. And through this work, she helps to ensure that community insight directly informs policy development, advocacy, and systems change efforts. So Parker and Teon, you all have the floor.
Flawless, flawless, flawless. Thank you. Thank you all so much for your patience. Once again, I'm Teon Hayes. I am here with my colleague, Parker Gilkesson Davis. Thank you so much, Parker, coming in to save the day, like always. So today we are going to walk through several major shifts that have happened in the public benefit system. And we are going to discuss what this means for families, communities, researchers, and advocates. Throughout this presentation, we'll also discuss why data, research, and community storytelling are becoming increasingly important as these changes unfold. So I will turn it over to Parker, who's going to start off with our changes and their impacts.
Yes, thank you, Teon. So, HR1 changes and their impact. When many people hear terms like work requirements or program integrity, it can sound like we're talking about making programs more efficient, right? But let's be honest about what's really happening here. So, HR1 wasn't just a technical policy change, it was a deliberate decision to reduce investments in programs that millions of families rely on, like SNAP and Medicaid, and they rely on these programs to thrive, right? And all of this is happening, honestly, during an affordability crisis. So families are already struggling with the cost of groceries, rent, childcare, and healthcare. So when we talk about these changes, we're talking about policies that are landing on people who are already stretched thin. So this bill includes a handful of provisions, including expanding work requirements, increased reporting expectations, and shifts that move costs onto states. So on paper, those may sound like administrative changes, right? But in practice, they create more hoops for people to jump through and more opportunities for eligible people to lose assistance. So it's important to remember that SNAP participants who can work already work. Many are working low-wage jobs, caring for children or aging parents, or juggling unpredictable schedules. The issue has never been that people don't want to work. The issue is that people are trying to survive systems that often make it harder to meet their basic needs. So for Black families, these changes are especially concerning because they come on top of longstanding labor market inequalities. So when benefits are tied to more paperwork and more administrative hurdles, families can lose assistance not because they're ineligible, but because the systems are harder to navigate. So when we look at HR 1, we're not just talking about policy changes, we're talking about real losses for families. I know an example since last year, there has been a severe participation decline, and we'll jump into that next.
Thank you so much, Parker, for providing that important framing and context. So now we'll shift into what we call documenting the harm. Since the passage of HR 1, we have seen, as Parker mentioned, this rapid national decline in SNAP participation. Now, some people may look at these numbers and they assume that the need is decreasing, but that is not what the evidence tells us whatsoever. What we know to be true, we all know this firsthand, is that food prices remain high, housing costs remain high, and families are still really struggling to make ends meet. So when we see this declining SNAP participation, we should not automatically assume that the decline in need is decreasing, because that is not the case. So what's really important to name here, as heartbreaking as it is to see, the data has showed us that nearly 3 million people has lost their SNAP benefits since last July. Even more heartbreaking, we have seen that 700,000 children have lost their SNAP benefits since last July. This data directly contradicts what Congress told us would not happen when they were pushing for HR 1 legislation and debating these things. They told us that families would not see a loss in SNAP, children would not see a loss in SNAP, but now we have the data to prove that everything that they said was completely wrong. And that's why documenting the harm really matters. So as advocates, researchers, community leaders, and all the people who really care about our communities, we now have the responsibility to uplift the stories and the testimonies and the lived experiences behind these numbers. We have to show that these policies, decisions, and what they look like in real people's life, and how, and hold, most importantly, decision makers accountable for the consequences. This information is especially important for Black families because we know that Black households continue to experience food insecurity at higher rates than white households. When access barriers increase, communities already experiencing high level of hardship are often the first ones to feel the impact, and they tend to feel it the hardest. So it's also worth putting these numbers in perspective, because during the Great Recession, it took years to see participation declines of this magnitude. So what we're seeing now is happening at a much faster pace. So as we watch the SNAP participation decline across the country, it's important to remember that this isn't happening because people are less hungry or food insecurity has disappeared. People are not less hungry, and the system has just simply become very hard to navigate. So now Parker will talk about the elimination of the USDA food insecurity data and what that is doing to our communities.
Yes, thank you, Teon. So you heard Teon talking about documenting the harm. So I want you all to remember that while we're discussing this issue. It may seem technical, but it really does have profound implications. So the USDA Food Insecurity Survey has long served as one of the nation's primary tools for measuring hunger. For decades, this report has helped us understand who is struggling, where needs are growing, and whether policies are helping or harming families. The decision to eliminate the publication of this report makes it harder to quantify hunger and assess real-time impact of policy changes. which is intentional. It also reduces visibility, accountability, and the ability of researchers, advocates, and policymakers to respond effectively in moments when families are most vulnerable. The danger is not only in harmful policy decisions, but also in the ability to fully measure, document, and respond to the impact as it unfolds in real time. When we cannot measure harm, we truly risk normalizing it. And for Black communities, data matters because data creates visibility. It allows us to document disparities and hold systems accountable. So when we stop measuring hunger, we don't eliminate hunger. We simply just make it harder to see. And one of the papers Teon and I wrote was like literally slipping through the cracks, right? Becoming invisible. At a time when many researchers and advocates expect food insecurity to increase, we are simultaneously losing one of the most important tools used to track that increase. And while we are losing some of our ability to measure need, we are continuing to hear narratives to justify restricting assistance. I hand it back to you, Teon.
Thank you. So next we are talking about the bigger narrative, and this is really Parker and I's jam. We believe in demystifying narratives and really calling out the roots of narratives. So one of the most persistent narratives surrounding public benefits is the idea that fraud is widespread and that stricter rules are needed to prevent abuse. But it's really important to know the roots of the fraud narrative. For decades, discussions about public benefits have been shaped by these racialized stereotypes that portray Black families, communities of colors, immigrants, and people experiencing poverty as undeserving. We've seen this in the form of the welfare queen, the myths to the current discussion about government assistance today. Fraud narratives are not reflective of reality. Rather, they are a powerful, very powerful tactic that has been used for decades, centuries, to really shape public opinion and justify the cuts to public benefits as well. They create this perception that large numbers of people are cheating the system, even when the evidence shows the complete opposite. What we often do not see and what we often do not hear the other side of the aisle talk about is the evidence of fraud that we do have. And that evidence is not committed by participants. It is things such as EBT skimming, where benefits are stolen from SNAP participants, or the incidents like Mississippi TANF situation, where Mississippi decided to use TANF dollars for something that was not related to the program. Like, these are the evidence of fraud that we do not hear folks talking about. But we know that fraud narratives rarely result in policies that effectively target actual fraud. Instead, they move more towards driving restrictions and really impacting eligible families. What we really want to name here is the racist roots that continue to shape and frame the fraud narrative. What we are currently all witnessing are these surface level expressions of systemic inequities, but underneath all of this, there is something much deeper. What we do not always see is the undercurrent, the narratives, the assumptions, and the values that are really driving and shaping these outcomes. These are not isolated events. They are shaped by deeply rooted mental models, and those are our beliefs and our assumptions and the stories we hear about who is deserving and who is not. So as we continue to engage in change and narrative work, we have to start at the root and really dismantle the foundation that allows racism, sexism, ableism, all the isms to really continue to reproduce themselves. And now Parker will talk about the importance of data, information, and storytelling.
Yes, thank you, Tiana. That was powerful. So next, we want to close by focusing on work that is very close to our hearts. So community engagement and what communities can do at this moment. It is so important to remember that there is real power in collective action, and it's going to take a village to clean up this mess, okay? We want to remind you that each group has a pivotal role to play in sharing data, stories, and findings. We have to document the harm in real time and make it impossible to ignore. So for researchers, as federal data systems become less robust, community-engaged research becomes even more critical at this time. For advocates and practitioners, what you are hearing from families every day is evidence. What you are seeing at food pantries, schools, at community organizations, I see it, at my daughter's daycare. It all matters. Putting a human face to this moment is essential. These stories help us understand impacts and statistics alone cannot capture. So the long-standing work of narrative change must center dignity, truth, and the voices of the most impacted. So if federal systems stop measuring hunger, communities must continue documenting it. If harmful narratives continue spreading, communities must continue telling the truth. And if barriers continue growing, communities must continue evaluating the experiences of those most impacted. All right, I'll pass back to you, Dan. So thank you.
Thank you. And we'll hand it over to Dr. Moore.
All right, so let's see if I can get my slides up. So good afternoon, everyone.
Dr. Shaneen D. Moore is the Assistant Commissioner for the Family Wellbeing Administration for the Minnesota Department of Children, Youth, and Families. Dr. Moore previously served as the State Child Support Director and Deputy Assistant Commissioner at the Minnesota Department of Human Services. She leads key initiatives in Minnesota's Human Service Program delivery system, focusing on improving the lives of children and families. All right, Dr. Moore.
Okay, so good afternoon. I'm Dr. Shaneen Moore, as folks have mentioned. I've been at the Department of Children, Youth, and Families now for almost 2 years. We are a new state agency here in Minnesota that came together in 2024 as a result of our governor and folks in Minnesota wanting to improve the lives of children, youth, and families. And so we separated from the Department of Human Services, and in addition, we've added pieces of Department of Education, Department of Health, Department of Public Safety to form our new state agency in hopes that we create brighter outcomes for children and families in the state. As a result of that, I became Assistant Commissioner for the Family Wellbeing Administration in 2024. So I have the responsibilities of SNAP, TANF, emergency assistance, and the child support program under my administration. So I want to start with this quote because I think it's relevant regarding the impacts that not just HR 1, but the changes that the federal government has had on the impacts of Minnesota. So the ultimate measure of a man is not where he stands in moments of convenience and comfort, but where he stands at times of challenge and controversy. So Reverend Dr. Martin Luther King Jr. The reason this quote resonates with me as someone who lives in the city of Minneapolis, once the federal administration changed and the fact that the current president has had a target on the back of Minnesota for the last 18 months, we have been doing everything in our power to resist and fight against the ills that are happening. And so, really a lot of this started pre-Operation Surge at the beginning of this year. However, I feel that in many instances, the level of assault against the state of Minnesota has only risen. And so my staff and my colleagues at the department, we continue to have these ongoing conversations and working with our governor's office to figure out ways in which we can strategically support families in the state while also dealing with the ongoing confrontations that we have with the federal government. And so keep us in your thoughts because every day is a challenge and we will continue moving the work forward in our state. So I want to talk a little bit about the key challenges that we are experiencing here in Minnesota as it pertains to HR1, and in particular, the impacts that HR1 is having on our SNAP program. So as previously mentioned, HR1 provisions were not just a policy change, but really is changing how we operate our programs. And in many instances for SNAP, these are changes that have never been seen before in the history of the SNAP program. So again, these changes are impacting families, older adults, veterans, youth, and in particular, I would say immigrants across our state. It's causing us to reevaluate our programs and how we're administering SNAP in particular. And so the whole goal of all of these changes is really to reduce the number of folks that are going to be eligible for SNAP in the long term. So for example, in Minnesota, we have 440,000 individuals who receive SNAP. And we expect that on average, they will lose $5 less per month in their food benefit. It's also creating impacts. I know a lot of folks think that SNAP is just a food program, but it is really a system. And so it's causing reduced demand for our local retailers and grocers. And so that continues to create concern for the economy as well. So in modifying our SNAP work requirements here in Minnesota, we are starting to see major impacts. So as mentioned, the work requirements expand the age of those who are expected to work through the age of 64. It used to be 54. And it limits the exemption for households with children that are now, it's just the age of under age 14, where it used to be 18. And so it really removes the exemptions that some of our most vulnerable populations have been able to utilize in the past. And so in Minnesota, about 4% of our participants, or about 18,000, will be subject to work requirements. 2/3 of folks receiving the benefit are older adults, and 1/4 of those are adults with children who are age 14 and older. So that's a significant amount of our participants who are going to be impacted. 1/3 of those that are projected to lose benefits are those that will be experiencing that loss due to work requirements. And something that we're currently grappling with are young people that age out of foster care. They already have their concerns and things that they're trying to manage coming out of that system. So we are adding another burden by having these work requirements and then being able to address those in a meaningful way. And then prior to HR1, 17 counties and 9 tribal nations here in Minnesota had access to the waiver due to high unemployment rates. And as you can imagine, most of those counties and tribal nations are in rural Minnesota. And because there is low job availability out there, that will also create a major concern. With the change in law, we currently now have only 3 tribal nations in our state that will qualify for that exemption under the new law. Regarding standard utility allowances and energy assistance programs, so the change with HR1, LIHEAP, which is a energy assistance program, is used to be an automatic qualification, but now they're changing that standard so that only elderly or those with a disabled member in the household will be eligible. Right now, we aren't seeing a fiscal impact, given that many of those folks that qualify for emergency assistance will still continue to qualify. And so I think as time goes on, we will have to monitor those concerns and ensuring that if there are additional needs as a result of the change, that we're able, maybe from a legislative standpoint, change our funding and processes here to address that concern. Regarding restrictions on internet expenses, so HR 1 prohibits internet costs from being included in excess shelter deductions. This did not have a direct impact for us because of Minnesota. We were set to implement the calculation in federal fiscal year 2026. However, because of this change, we simply did not have to address it. And so this one did not have impact for us here in Minnesota. Matching funds requirement. So this is one of the bigger issues because we are a state supervised county administered state. And so we have 87 counties within the state of Minnesota, with each having their own SNAP programs. And so currently with the change, we are now and this is the first time in many instances throughout the program that we're being asked to pay 15% of SNAP benefit costs. And what makes this challenging or difficult is because it's based on payment error rates in prior years. And so the payment error rate is a big deal because that is how states are receiving funding from the federal government. And so the lower the payment error rate, the lower amount of contribution you will have to make in supporting the cost of the program. And so, every year USDA issues and publishes the national payment error rates across the country. So that will be coming at the end of June. And then based simply on our payment error rate as of federal fiscal year 2024, we are estimating that we will be responsible for about $97 million. And that could potentially project upwards, but $97 million every single year is a lot of money to have to come up with. And I feel like this particular change in particular, I feel like the federal government has implemented this in a way to squeeze states out of wanting to administer SNAP. And so we are lucky here in Minnesota. We have a supportive legislature that is helping to support how we're able to cover the costs in this situation. Next, so our administrative cost sharing. So this is the cost that we are having to share across the program with our county and tribal partners. So the federal reimbursement for administering SNAP is being reduced from 50% now to 25%, which is forcing states to cover 75% of their program costs. And this also is impacting SNAP outreach and the work that we're able to do because they are also losing reimbursement. And so again, in Minnesota, our fiscal impact is about $37 million annually and about 2.1 million as it pertains to our SNAP outreach program. This will mean that we will have fewer administrative resources at the state level, which will then impact local government and community organizations that are important pieces of that puzzle in helping to support our SNAP program. And then, as you all may or may not know, SNAP Ed funding was totally eliminated under HR 1. And so what this means for us is that money that we were using to help provide education and learning on food classes and things that support families in that way. Minnesota has lost $9.5 million as a result of the changes in the elimination for SNAP Ed funding. Another big piece of this is centering the importance that SNAP plays for legalized citizens in our country. And so prior to HR 1, SNAP was limited to US citizens and certain legal non-citizens. And so the new law further restricts SNAP for non-citizens to only lawful permanent residents. So that would include Cuban and Haitian entrants, residents of Micronesia, the Marshall Islands, and Palau. And so the impact really is creating higher administrative costs for us here in Minnesota in administering the program. We have about 9,000 folks that will be impacted by this change. And so they will no longer be eligible for federal SNAP benefits. However, in the state of Minnesota, we do run a state program. And so those folks will then be a part of that state SNAP program, which then will cause the funding and costs for that program to increase substantially. You know, as mentioned previously, many groups are going to be impacted, but, you know, as far as the immigrant population, they are also going to be considerably impacted. So other changes I want to mention in this process, for many states, Minnesota, we have a legacy case management system that is over almost 40 years old. And so when we got word that, you know, we had to make these critical changes, that means we're spending millions of dollars to update our case management system in order to meet those new requirements. And so this past legislative session, we were able to have conversations with our legislature to ensure that we had some funding allotted for those necessary changes in order to implement moving forward. It is also causing increased costs for counties. So as they're losing administrative costs on the local level, that often means they're going to have to increase property taxes in order to help fund programs as a result of the loss of funding from the federal government. As you can imagine, this is causing a significant resource strain on employees who are working at the local level. We already have a complex system with administering SNAP, and so this is increasing that caseload and the levels of complexity that those folks have to manage on a day-to-day basis. In the midst of us having a staffing shortage in many of our counties. And then finally, our eligible participants in the state of Minnesota, I'm thinking this is probably impacting others in the same way, but many folks that are eligible for SNAP are not applying because they're in fear of immigration policy and potential data privacy concerns, given that the federal government is asking for data that they've never asked for before. And so that is creating a real concern for people in wanting to apply for the program. So in conclusion, I just want to say that it has been a very difficult and challenging year in implementing HR 1 here in the state of Minnesota. You know, there are many fears from not just administrators, but program participants and what that will mean for the future of SNAP. You know, will we come to a place in this country where, you know, local level organizations may choose not to administer because of the cost and the complications? That is definitely something I know is at the front of mind for folks here in Minnesota. And then also, in many instances, by creating these additional barriers and folks not applying for SNAP, it is putting an additional strain on our food security and food bank resources here. And so that will then play out again in the legislature because we have to continuously ask for more and more financial resources in order to help manage that additional strain that is being caused. So that is what I have for my presentation, and I'm open to questions.
Thank you so much, Dr. Moore. Thank you, Teon and Parker, as well, for your presentation, a very comprehensive overview of where we are with HR 1 from an overall research and federal perspective down to the state level impact. And so you all that are attending, feel free to put in the Q&A box any questions that you have. Even if you put in the chat, I should be able to catch them there as well. If you have questions for our panelists, I'll start out. Of course, we are all researchers and have a heart for our communities and want to make sure that needs are being met and that solutions are being pushed forward. What would you say are some of the biggest unanswered questions about these new changes to the public assistance benefits that research could possibly help answer?
I could maybe start with that. I know in many instances, I am fortunate to be in a state where we collect the demographic information, but I think the biggest concern from a research perspective, when all of this is done and said, what impact is this going to have on communities of color, in particular the African American community? As Parker mentioned, like, if the federal government isn't collecting the information, it will be important for community impact researchers to continue to collect the information because there is going to be a real impact. And so being able to show that in the future in order to hopefully try to navigate and change the things that have occurred during these 4 years will be critical.
Thank you, Dr. Moore.
I can hop in next. One area that Parker and I are really trying to learn more about are the solutions. What's happening on the ground? How are people remaining fed? How are people filling in the gaps while the federal government is failing us all? It would be great to have more research about those solutions and how those solutions are being funded. Everybody, we are all stretched thin right now. So learning anything about the resources and the funding that's being poured into those solutions, I would love for that to be a resource for our communities, because eventually we are going to have to clean up everything that's happening. So if we already have that information out there, it will give us a head start when it's time to clean up.
Excellent. Nice. And so when we think about, I don't know, were you going to say something, Parker, or did Teon cover it?
Nope, she took the words out of my mouth.
Okay, I thought so, but I just wanted to check. And so we're also community engaged researchers. So we work with our partners in community, and really, I want to hear from you all what you think, what type of partnerships, between researchers, advocates, agencies, and communities, what will be most critical as we move forward in terms of partnerships and opportunities in these particular, challenging moments.
Yes, I think what Teon and I mentioned earlier is documenting the harm. Documenting the harm that's happening while also working together to document what is working among community members, and trying to connect the dots. That's one thing that we're working through as a team and an organization, is how can we be a bridge to help folks connect the dots, to see what's working. We want to uplift SNAP. We want to uplift other food assistance programs and other public benefits programs, but we also want to hold the reality that people are losing benefits today and every day. And how do we support those people and make sure that they have everything that they need to live and thrive? So that's one thing that I think is important. And us beginning to work together as an ecosystem, and not being so siloed. I think that's important as well.
Absolutely. There's a specific question for you, Dr. Moore, in terms of Minnesota. where you have state funded SNAP benefits, have you seen significant increases in the administrative effort to transition people who are not eligible for the federal benefits? And have you seen increases in the distribution of nonprofit organizations?
Yeah, so that's a good question. We're starting to see some shifts. Again, I think because we are still dealing with, even though we don't see them as much, we still have federal agents here. And so I think people are still fearful of being in community and applying for benefits. And so we do have a strong network here in Minnesota and how we work with our nonprofit organizations. And so I think that will only continue. But I think as this prolongs, there are going to be more and more shifts that we're going to have to manage. There are going to be more and more asks from our legislature regarding being able to fund these programs that are no longer being funded by the federal government. And so I think we're kind of in a wait and see game at the moment.
Mhm. Thank you for that, Dr. Moore. Um, what would you all say is one concrete action that we should take, possibly in the next 6 months or so, to help our communities navigate and respond to some of the challenges and changes that you all have described?
Yeah, for us, we continue to meet and convene with our tribal and county partners. So we try to problem solve collectively, as things can continue to change and unravel. I think it'll be critical that where we can partner and collaborate and solution together will be a big part of how we come on the other side of this, out on the other side. Um, Also, we've started to have conversations with our philanthropic partners because it will be critical, where they're able to help support and uplift these needs and fund in many instances. That will continue to be a need, especially now during this time.
I can hop in next. I think definitely plus one to everything Dr. Moore said. Collective action, as Parker mentioned in the presentation, is so powerful. When I think about the older folks in my family and they talked about hard times and how they were able to go next door to get fed, or when a woman had a baby, she was taken care of. Members in the community got together and made sure diapers were supplied for a year. Like that is the type of like care that I would love to see like come back into our communities. The tactics that are happening right now are really to divide us, is to make us to like feel isolated, to make us feel like we're by ourselves. So I really think right now is the time for you to come together with the folks near you, to problem solve together, to be in community together, passing along that community wisdom. Parker and I just got off a call with a colleague, and she was talking about the ancestral wisdom that has been lost in our communities, like getting back to the roots, getting back to our identity and who we are to the core, because the solutions and the answers lie within us. We have the power. So I definitely think that is so important. And the next one, we always say this, rest in peace to Nipsey, but the marathon continues. This is not a sprint. This is a marathon. So making sure that we're also taking care of ourselves while we're pouring into the community, you have to also take care of yourself so that you can have the energy and the fuel that you need to really fight this fight, because this is a long fight.
Yeah.
It's not ending tomorrow. So yeah.
Yeah, and I'll give an example just in community. So I live in North Minneapolis, which is considered the Black community of Minneapolis, and I'm a part of our neighborhood association. So we decided this year we have a community garden, and so we are planning to plant vegetables and have the little, the little things that have the food.
Mhm.
You have books sometimes, you put books in,
Mhm.
but we're going to do a box just for fresh produce and things.
Mhm.
So anyone in the neighborhood who, is hungry or is in need of food, then they will be able to access that box. And so can you imagine having little food pantries all over? And it's not a difficult thing to do. You just plant, grow, and share. And so we
Mhm.
came up with that concept. So I'm hoping, yeah, micro food banks.
Mhm.
I love that. One thing I
Yes.
would just add really quick, because y'all have taken the cake, Dr. Moore and Teon, is that we're going to have to get back to trusting each other again. Individualism, we can't move in that direction any longer. We have to come together collectively. And one thing, I'm grateful that I have older grandparents. They're old, but they always talked about during the Great Depression, at that same time was the Harlem Renaissance, and how we know how to survive. We know how to thrive. We know how to come together. And so getting back to that, and each of us have different skills. So maybe you don't like farming, but maybe you can cook. I'm not necessarily, I don't have a green thumb, but I could throw down in the kitchen. Okay. Yes. So whatever your skill is, getting back to that collectivism where we help each other. I think that's going to be something that's important. And obviously we connected to policy and making those changes as well. But when it feels dire, when it feels like we are saying all these things and nothing is changing, remember that it's within us. We can make the changes we want to see on a personal level.
Awesome. And you really kind of talk right into my next question in terms of thinking about the previous times, right? Like you said, Great Depression, Harlem Renaissance. So what are some of the lessons that we can learn from some of those previous kind of policy changes, structural kind of things that happened and impacted our families, particularly when we're starting to help our families navigate these challenges, and also as we're thinking about from a research standpoint, how we design our research studies when some of the, programs are going away and some of the, trust is being lost.
One
So what,
thing really quickly I can jump in and say, we as Black people, we can see the proof in the pudding. We can see what's starting to happen. Many people feel like, oh, these are unprecedented times. Nothing like this has ever happened before in all of these things. And we can see like, okay, we know what this is about to be. So getting prepared even when our other colleagues may not be there yet. Like Teon and I have been having a lot of conversations about what happens if an unprecedented amount of people are cut off SNAP. What are we going to do? In November, when they were talking about, not giving out SNAP benefits, we realized there is nothing else comprehensive that could serve people in the way that this program does. So if that is to happen, which is a goal, please believe that. What are we going to do? And it's up to us to start thinking about that and planning for that, because our other colleagues, they don't see it coming. They think that would never happen. We're always going to have SNAP. And those of us know we just started being allowed to receive public benefits in the 60s. This was not a program that was for us. Okay. So we've had to make it without these programs. So if it happens that these programs, something happens, God forbid, we're going to be able to make it without them. So being able to see the proof in the pudding and start gearing your research in that direction, even when funders and other people, they don't see it yet. They really don't. They're going to be shocked when it happens, similar to how they were shocked when the first election with Donald Trump. Yeah.
No, I would totally agree. And we've been here before. So how can we take those lessons that we've learned in the past and make them meaningful for the present?
Mhm.
Yeah. My advice, even though I am still working on getting there, being fully transparent, I would say that the importance of imagining what was possible. Like when we look at the people who came before us, they had huge imaginations and they did not limit themselves to what was politically feasible. They imagined a life where their descendants could thrive and be treated with care and fairly and love and all of these beautiful things during a time where they were being unfortunately hung from trees. So not limiting ourselves to what we currently are seeing and boxing ourselves with these guardrails about what is possible. No, having those big, wild imaginations and putting that information out there, even when it does not seem possible right now. Once again, I'm still trying to get there because it is hard when you're in the trenches and you're doing the everyday work. Having that creative, imagination is very hard to get to, but we know what we deserve and we know what's possible. So having more opportunities where we can get in those spaces and have those conversations, and also instill that in our children. Like I have a 2-year-old son, and I'm raising a Black boy, and I want him to know what is possible. I want him to always aim for what is possible, not what this world is telling him he is and who he should be. That's not acceptable. So I'm definitely trying to get to that place.
Amazing. Wonderful. Well, thank you, ladies, so much for sharing your perspectives and your research and your work. Thank you for the work that you're doing for and in our communities. I want to see if there's any kind of last thoughts that you want to give to this audience. And again, this will be on our website, so it will be available for others to see. If there's any last thoughts that you want to share with our audience, you have the floor.
For me, it's just recognizing we are in challenging times. Like we've talked about today, they're not going to get any better anytime soon. So having the wherewithal to continue and keep going and keep going and keep going when you think you can't go any further. Um, you know, we are a community and we've faced challenging times before, and hopefully this soon will pass as well.
Thanks, Dr. Moore.
I can jump in really quick. I'm going to go in a different direction just a little bit. We are working on gearing up for our food sovereignty work. So like we mentioned, we want to expand beyond just having conversations about the SNAP and WIC program and other food assistance programs, but we want to connect the dots of people who are already doing the work on the ground and figure out how we can be a bridge to them. So if there's anyone on this call or anyone that you all know who is doing work in terms of co-ops, gardens, I mean, anything that you can think of in terms of providing food assistance to their communities, or even if they're just a gardener themselves, we would love to hear from them. We would love to connect with them. And also we're looking to connect with folks who do want to vision something different, like Teon was talking about, for public benefits for the future. We're trying to figure out how to frame it, because for our community, for some people, talking about public benefits, they're like, I don't see that as economic justice for myself, right? But what could it look like and what could we envision? And we really want to work together with people to imagine that and how it would best support their communities. So just wanted to put that spiel out there. If there's anyone who knows a person who knows a person, that would be great.
Awesome. Thank you, Parker.
Thank you, Parker. I will end with just reiterating the importance of self-care. What we're seeing right now is not only an attack on our minds, but it is an intentional attack on our bodies as well. So just the importance of taking care of yourself during this fight. We always hear the analogy that while you're on the airplane, if something happens and the air things come down, you put yours on before you help the person put the mask on with the person next to you. But that is like very important in everyday life, just making sure to take care of yourself during this fight.
Wonderful. Awesome. Okay, thank you, Parker, putting your information in the chat to address the ask that she had. If folks watching just later on, I can make sure we get you connected to Parker and Teon if you want to reach out to them. But yes, thank you all so much for sharing your wisdom with us today. Thank you all for attending. I told you the hour was going to be gone like that. So please give us your feedback. I put the link to the survey in the chat. We want to hear from you and learn what else we can do to support you during these times. But thank you all so much for your time, and we will certainly be in touch. Have a great rest of your day.